Hi guys, I'm Erin Trimble, VP of Business Development at Redox, and we're coming at you from Health Further 2017 in Nashville. And I'm joined by Keith Smith, Medical Director of the Surgery Center of Oklahoma. Welcome, Keith.
Thank you.
Good to meet you. Cool, so tell us a little bit about your role and a little background and maybe what brought you here to Health Further today.
Well, Dr. Steve Lontier and I co-founded the Surgery Center of Oklahoma about 20 years ago, really with the mission that we'd be honest about pricing with our patients. And that really culminated about 9 years ago now when we put all of our prices online for the hundreds of procedures that we do. And it's just had a really shocking effect on the marketplace, not just where we are, but all over the country. People will print out our prices and leverage a better deal in their hometown and step up where I'm flying to Oklahoma City. And it's also exposed a lot of what's wrong with healthcare because the traditional PPOs and insurance carriers, they hate us. They don't like what we're doing.
What's their reaction typically?
They just ignore us. But they make a lot of money by selling discounts, and our online pricing does not afford them that opportunity. So it's been very exciting to wrap our minds around really what is going on, what's wrong, and also to meet people from Canada and all over the place that come to our facility and just buy surgery.
Yeah, and what's the reaction from patients apparently has been quite positive.
They love us. They're very educated, they're very savvy, they understand their condition, they've shopped around. The delta between our pricing and their next best price is shocking many times. It's not uncommon for there to be a $50,000 difference in a price for surgery for something relatively minor. So,
and why is that? How do you guys manage to do this much cheaper and be so transparent about it when most of the market is far from that?
Well, the real question, we're making money.
Yeah.
The real question is, why are all these so-called not-for-profit facilities charging 10 times what we charge?
Right.
We have sat down and looked at, what does it cost to do a case? How much profit do we need to generate? And it's not even algebra, it's just simple math.
Just understanding your basic cost structure.
We came up with prices that we're unapologetic about, that we can look at a patient and say, your gallbladder surgery is $5,865, and that's the surgeon, anesthesia, and facility. And that's the price we think belongs to it. But I really don't know if my prices are right until we have multiple competitors in the marketplace competing with us.
Yeah, and have you seen those competitors emerge?
They have, and I've actually helped many of them get started because we'd like to see a competitive marketplace in healthcare in the United States.
Absolutely.
But, the usual suspects really are trying to stomp that out.
And why do you think that is? What are the sort of barriers to full price transparency across healthcare? I mean, I'd love to know how much any procedure or appointment might cost me out of pocket.
Well, there are a lot of people in the industry that make a lot of money behind the veil because you cannot see the pricing.
Yeah.
And so they have a vested interest in making sure that it is very confusing.
Yeah. And what would you think it would take for the market to really move in that direction and for you to see, a world of competition?
Well, it is an adequate number of sellers in the marketplace like me, but it's an increasing awareness of the buyers because entrepreneurs typically respond to a perceived future demand.
Right.
And I think as the sellers in the marketplace begin to understand that the buyers know that the jig is up, the prices are known, we have got to cater to this particular buyer or risk losing the business of that buyer.
Right.
That's why the self-funded community is so powerful. Such a powerful part of this.
Absolutely. So to your point about entrepreneurs, I mean, Redox works with hundreds of emerging startups in healthcare. What's your advice to an entrepreneur that's thinking about getting into the industry?
Well, the first thing they've got to understand is what are their gifts? What is it that they can provide? What is it that the market in the future is going to crave or desire, and can I supply it? I think of our model as delivering obvious value. A lot of people claim to be entrepreneurs and all they really are interested is generating revenue. But that takes the focus off of the consumer, the buyer.
Right.
So I would encourage anybody entering this space in healthcare to reject the old model of how do I maximize revenue, and rather how do I deliver the most outrageous, astonishing value, and they'll be successful.
Yeah, it's great advice. And so, price transparency aside, what are the big opportunities you see for entrepreneurs in healthcare in, say, the next 5-10 years?
I think that there are opportunities for intermediaries to educate buyers. There are also opportunities for intermediaries to educate sellers for how to enter this marketplace and why to do it. And I also think there are opportunities for the intermediaries that can facilitate the exchange of information and payments between the buyers and sellers. So that's a lot of opportunity.
Cool. Yeah. Well, I think we're already seeing, a few hundred entrepreneurs start tackling all of those. So you've been in the business for, it sounds like, at least 20 years. Healthcare has evolved dramatically in some ways and not so dramatically in others. What are some of the more exciting innovations and changes you've seen in your career?
I think one of the most exciting things that I've seen in the medical marketplace really is the result of what we've done, and that is more and more people being honest in their pricing. In terms of technologically in the healthcare industry, there are too many things to mention. I think what I'm most excited about now, though, is that more and more people are insisting that the same discipline that the free market forces every other industry to endure has a place in the delivery of, in the selling of medical services. And that's radical. It's a real throwback. It's the way things used to work before Uncle Sam screwed everything up. It's very exciting to see.
It's great. And I guess my last question for you is, what are your plans for the rest of the time you're in Nashville?
Our plan is we have no plan. So we're going to explore the city and just relax.
Great. Well, thanks so much, Keith. It was a pleasure to meet you. And
thanks for having me.
We appreciate you taking the time.
Thank you.